Hello, and welcome to the Quality Insights Practice Module Overview on Stroke Prevention Strategy, Cholesterol Management. My name is Cindy Biederman, and I'm a Practice Transformation Specialist with Quality Insights. This module is part of our ongoing efforts in providing Pennsylvania medical practices with information to assist with improving the management of prediabetes, diabetes, blood pressure, and cholesterol. This live activity and enduring material has been planned and implemented in accordance with the accreditation requirements and policies of the Accreditation Council for Continuing Medical Education through the joint partnership of the Pennsylvania Medical Society and Quality Insights. The Pennsylvania Medical Society is accredited by the ACCME to provide continuing medical education for physicians. The Pennsylvania Medical Society designates this live activity and enduring material for a maximum of 1 AMA PRA Category 1 credit. Physicians should claim only the credit commensurate with the extent of their participation in the activity. This course is approved for 1 hour of continuing education for nursing. Quality Insights is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The planners and the faculty for this live activity and enduring material have no relevant financial relationships with ineligible companies to disclose. All of the content we'll be reviewing today is a summary of a printable resource produced by Quality Insights in fall 2021. You can find the downloadable PDF version of this module by visiting the Quality Insights website, which is linked here as well as at the end of the presentation. Please keep in mind that the various resources in the module are not endorsed by Quality Insights, and that guidelines and recommendations referenced are to be used along with clinician judgment and based on individual patients' unique needs and circumstances. During the current coronavirus COVID-19 pandemic, cardiovascular health remains a top public health priority. Not only have there been more deaths from cardiovascular disease during the pandemic, but people who have serious heart conditions are also at elevated risk for severe illness from COVID-19. Quality Insights joins the Centers for Disease Control and Prevention's Million Hearts Initiative and health organizations across the nation in spotlighting the importance of maintaining heart health, especially during COVID-19. See the module for links to Million Hearts resources. The 2018 Guideline on the Management of Blood Cholesterol, published in the journal Circulation, is a full revision of the 2013 American College of Cardiology and American Heart Association Guideline on the Treatment of Blood Cholesterol to Reduce Atherosclerotic Cardiovascular Risk in Adults. It provides current cholesterol-lowering recommendations, including lifestyle interventions, statin and non-statin regimens, risk assessment tools, and management of specific patient populations. A Guidelines Made Simple summary is also available, and all of these resources are accessible through links in the Learning module. A 2019 AHA report cites an estimated 6% of all youth 2 to 19 years old are afflicted with severe obesity in the United States. Unlike moderate class 1 obesity or overweight, rates of severe obesity have increased over the past decade. The report, in addition to the challenges of the COVID-19 pandemic, highlights that children and adolescents may be at higher risk for cardiovascular disease. Primary prevention of atherosclerotic cardiovascular disease, Ascpd, over the lifespan requires attention to prevention or management of Ascpd risk factors beginning early in life. Although LDL-C is a primary cause of atherosclerosis, other contributing risk factors exist. These major risk factors include cigarette smoking, hypertension, dysglycemia, and other lipoprotein abnormalities. Because atherosclerosis progresses with advancing age, a person's age also counts as a risk factor. Additionally, the guideline adds factors like family history and ethnicity, as well as certain health conditions such as metabolic syndrome, chronic kidney disease, chronic inflammatory conditions, premature menopause, preeclampsia, and high lipid biomarkers. The AHA recommends all adults aged 20 or older should have their cholesterol and other traditional risk factors checked every 4 to 6 years, as long as their risk remains low. After age 40, the 10-year risk of having heart attack or stroke should be calculated. People with cardiovascular disease and those at elevated risk may need their cholesterol and other risk factors assessed more frequently. The guideline outlines these values as acceptable, borderline, and high measurements for adults. Links are provided in the learning module. The use of quantitative 10-year risk assessment based on measurement of traditional Ascpd risk factors and with the use of a validated risk prediction tool is an important first step in considering treatment options for primary prevention. The Ascpd Risk Estimator Plus, intended and validated for use in patients aged between 40 and 75, is currently recommended for assessing a patient's 10-year CVD risk or lifetime risk estimation in younger adults to inform intensity of statin dosing. The tool is available by app from both the ACC and AHA or by accessing the online version. A patient-facing risk calculator is also available from AHA. Coronary artery calcium, CAC, also called a coronary calcium scan, is a non-invasive CT scan of the heart that calculates risk of developing coronary artery disease by measuring the amount of calcified plaque in the coronary arteries. For selected examples of candidates for CAC measurement who might benefit from knowing they have a 0 CAC score, see the 2018 Guidelines Made Simple. Recommendations for living a healthy lifestyle, comprised of eating a nutrient-dense diet and the inclusion of regular physical activity, remain a focal point of the 2018 AHA-ACC cholesterol guidelines, as well as the 2019 guideline on the primary prevention of cardiovascular disease. The CDC recommends these evidence-based lifestyle change programs as appropriate choices for referral of adults with high blood cholesterol. These lifestyle modification resources and referral recommendations are included in the 2018 guideline as part of the checklist for clinician-patient shared decision-making for initiating therapy. Link to these and other resources in the learning module. The Community Preventive Services Task Force recommends tailored pharmacy-based adherence interventions for cardiovascular disease prevention. Evidence shows interventions delivered by pharmacists in community and health system pharmacies increase the proportion of patients who reported taking medications as prescribed. The CPSTF also finds these interventions are cost-effective for cardiovascular disease prevention. The Pennsylvania Pharmacists Association offers an array of resources promoting and advancing medication therapy management in pharmacies statewide. Specifically, the Pennsylvania Pharmacist Care Network is committed to working collaboratively with healthcare providers. Learn more about potential partnership opportunities and services by visiting the PPCN website. Beyond lifestyle interventions, statins continue to be the cornerstone of therapy for lipid management. High intensity, moderate intensity, and low intensity statin therapies lower LDL-C levels by greater than or equal to 50%, 30 to 49%, and less than 30% respectively. Recommended statin regimens for each intensity level are noted in the module according to the guidelines. Clinicians are recommended to assess for medication adherence and efficacy at 4 to 12 weeks using a fasting lipid test. Retest for adherence and efficacy should then occur at every 3 to 12 months, depending on the patient. The Mayo Clinic Statin Choice Decision Aid is another recommended evidence-based shared decision-making tool regarding statin choice interventions. This tool is designed to assist providers in determining individualized estimation of risks and benefits with and without statins. Learn more about the Statin Choice Decision Aid and how you can integrate its use into standard practice workflow by viewing the demo video presentation and accessing the Statin Choice Toolkit. comprehensive care team approach rooted in understanding the causes behind patient non-adherence and being willing to work with a non-adherent patient may improve future adherence or non-adherence with other caregivers. The learning module offers a summary of existing adherence-enhancing strategies healthcare teams can use in their efforts to improve statin adherence. Although statins are recommended with a high level of evidence, prescribing disparities still exist. The effects of race on statin prescribing for primary prevention with high Ascbd risks were evaluated in a 2019 study that concluded that Blacks are less likely to be prescribed a statin compared to whites in certain populations. Improved efforts for primary prevention of Ascbd with tailored interventions targeting patients with multiple vulnerabilities are needed to optimize statin utilization. The PREPARE tool is a social determinants of health assessment tool and resource guide. To learn more, refer to the Quality Insights learning module linked from this cholesterol management module. In the limited amount of time face-to-face that providers have with their patients, the ability to directly focus on their needs instead of a screen is critical. 3 key ways you can use your EHR to improve overall cholesterol management without losing valuable interaction time are regularly reviewing your quality measures related to cholesterol, being sure to document in structured data fields so you can readily account for who and how many patients are being referred, what types of programs are most often used, and run reports to ensure feedback reports are being obtained from referral partners, and the use of EHR alerts for important health maintenance alerts. See the learning module for more details. You will definitely want to refer to the learning module for an extensive list of resources for patient education on cholesterol management. Some of the topics include familial hypercholesteremia, heart disease in women, heart-healthy lifestyles, statin and non-statin therapies, and more. I hope today's brief overview of the cholesterol management learning module has been helpful, and you'll be able to use this information in your practice. We invite you to visit the Quality Insights website to download and review all of the available information in this module. If you have questions or need assistance with implementing quality improvement activities in your practice, a Quality Insights Practice Transformation Specialist is here to help. Please reach out to us at any time. Thank you very much for taking the time to review today's recording. Have a great day.